Okay. Okay. I am Yasemin Afacan from Bilkent University. I am the chair of the Department of Interior Architecture and Environmental Design. And today I am going to present how architectural education can contribute to develop and apply gerontology knowledge of design students and foster their engagement with the effects of COVID-19 among older adults. Is my screen changing?
Yes, of course.
Okay. So what is the context? Within this framework, a graduate design studio in our department, a course was conducted with 14 interior architecture graduates at Bilkent University, Turkey. And the studio courses, as you know, are the core courses of design education, where we present creative ideas for real life problems. So in that respect, the course was designed in a blended learning format, so which means that it was based on combining face-to-face classes with e-learning modules. You see the students who were sharing their screens during the course time. And again, how was the course conducted? The course was structured over a period of 15 weeks in the 3 phases. And the phases names are as follows: divergent phase, which is related with the redefining key issues of gerontology during the pandemic. And then the second phase is called convergent phase, where critically assessing architectural design parameters within inter-transdisciplinary gerontology knowledge and domains. And the last phase is evaluation phase, which is related with producing meta-analysis to respond to the questions of what are the physical, social, cultural barriers of older adults during the COVID-19 pandemic. So this is, you see the weekly syllabus. As I said, you see the 14 weeks, and each week is related with the content. It starts with the introduction, and then 1, 2, 3, 4, 5 weeks for divergent phase with the presentations, with the quick sketch problems. And then the next phase is convergent phase, which is related discussions, again 4 weeks. And the last phase is evaluation, where the students develop their own research roadmaps and make connections between theoretical models and their roadmaps. So let's look at what has happened. We have 4 different meta-analyses as a result, having conducted 14 weeks. And at the end of the course, the engagement of students resulted in 4 different meta-analysis perspectives. Now I am going to show these perspectives. So the first perspective you see is related with the indoor artificial light, daylight, circadian rhythm. So what is it? A first perspective highlighted the relationship between behavioral symptoms, circadian rhythm, and lighting condition in nursing homes, as you see, which is very related daylight options or lighting conditions to enhance the circadian rhythm of older adults, especially during COVID-19. We had very difficulty with sleep or daily activities, and this perspective deal with the significance and the second perspective I will show in detail later each perspective. Now I am just defining. You see the image on the left-hand side, and this is the second perspective, which dealt with the significance of home architecture qualities and assisted technologies during the household isolation, which affected their daily living patterns. You see all day together at home, and it means that now if you are 3 people, now you are 7 people maybe, which can be a problem to create personal spaces. And the third perspective is related with investigation, the relationship between indoor environmental conditions of residential areas and well-being of older adults. You see the indoor air quality parameters like ventilation rates, or air cleaning, disinfection. And the final perspective is related with social and psychological needs, which is the aging, the student group reviewed the aging literature on open public space preference and their environmental satisfaction of older adults. You see the bubble diagrams with keywords. Now I am going to explain in detail each perspective. So you see the student names, they worked in groups, and this is the first group. Their topic was circadian rhythm, and their main research question was how circadian rhythm of older adults in nursing houses can be enhanced to minimize negative effects of COVID-19 outbreak. And they have sub-question which related with gardening facilities or natural artificial lighting or daily activities to improve their circadian rhythms. And you see the bubble diagrams, the keywords which related with circadian rhythm. If you have your circadian rhythm, then you are mentally comfortable, you have social integrity, and also you deal with physical activities like gardening. In this group, gardening especially related with bee architecture. And also the nursing houses, because we have houses, apartments, but the nursing house is a problematic area where older adults should live in certain cases. If you look in detail this group, then we see that new perspectives to the literature and research related to the lighting and circadian rhythm is needed. These are the bulletin points that the first group ended up. And since the effects of each session might be different on circadian rhythm because of different amounts of daylight exposure, further studies can be conducted during 4 seasons instead of only summer and winter. We see also the significance of season. And further studies could also include a comparison between young adults and older adults in residential environments. And the final is making the distinction between the light measurements of both daytime and nighttime is significant, since you know the nighttime and daytime differ significantly, which should be analyzed in detail. Now I am in the second perspective, which is related with home architecture qualities. During the COVID-19 pandemic, we spent most of our times at homes. So this group deals with the research question, how does the functionality of space impact the daily living activities of older adults during the household isolation in COVID-19? And you see the bubbles, the keywords. So the daily living activities are closely related with isolation with the family. They have less social interaction with others, of course, because of the pandemic. So as a result, older adults were homebound. And it creates the problem of functionality of space, because we need to have flexible spaces. There's lack of space, inadequate personal space, which results again uncomfort with visual privacy and acoustic privacy. So the group has also the sub-questions, the following sub-questions, such as what are the effects of less social interaction in elderly, what change in living activities after COVID-19. We have also post-COVID-19 issues, and what is the relation between functionality of space and household isolation. And then the final sub-question is how lack of space affect the living patterns of older adults. And these are the sub-questions. If we look at the phases and the relationship with the second perspective, you see the divergent phase, which is related with focused areas, research questions, and they focused on personal space. They focused on quality of houses. They focused on the knowledge domains of human-centered design and environmental psychology. And also in the convergent phase, the research resulted in older adults, their living patterns are changed as they are spending more time in houses, which would make functionality of houses very important. And this second perspective ended up with the idea, the need to be alone at home during the COVID-19 process and need support for personal care to live with their children. So they need personal care if they should live with their children. And the third perspective is related with indoor air quality. And the research question was, what are the impacts of indoor environmental quality in residential buildings on elderly people, health and well-being during the COVID-19 pandemic? So they related with thermal comfort, they related with acoustic comfort, lighting comfort, and indoor air quality, whose parameters are temperature, carbon dioxide, and humidity. You see the relationship diagram. This perspective is closely related with, as I said, natural ventilation, greenery areas. So similar to sustainable indoor environments and the thermal comfort, acoustic comfort, and lighting comfort. And this is the big perspective. You see the special aspects of the problem and which related, for example, considering the thermal comfort, you should lower the active system, such as shield beam, cooling tower. They should increase circulation of fresh air. They should design spaces. They should design space allocations considering sound level, or they should have eco-friendly material choices. And the upside again is the related environmental aspects of the problem, which are related with climatic conditions, urban features, overhead shades, green edges. And on the other hand, we have organizational aspects of the problem in the administrative controls, political domain, or multiple housing, or the standards related heating, ventilation, and air conditioning. And the third perspective ended up with the idea lowering use of active system and increasing use of passive systems to get advantage of courtyards such as, and their increased circulation of fresh air by using natural ventilation. They can use double glazing, they can use double skin facade, and eco-friendly material choices. And the final perspective is, as I said, related with open public space preferences. And the research question was, how does COVID-19 pandemic outbreak affect elderly's neighborhood open space preferences in terms of environmental satisfaction? And their environmental satisfaction is related in the research question with the keywords loneliness, open public spaces, open neighborhood space preferences, and environmental satisfaction, which means to understand one's world and circumstances and one's self, which are very important cases. And you see again the diagram, which relates the sub-questions with the knowledge domains. In this perspective, urban design, spatial planning, environmental psychology are the most significant knowledge domains. And you see on the right-hand side, the sub-questions which are related to social distance, social interaction, and environmental satisfaction, especially in neighborhood open space preferences. And this is very important diagram, again, shows the gerontology knowledge, shows the COVID-19 pandemic relationship, and the design knowledge in terms of open neighborhood spaces. You see how greenery, how transportation, walking distance, safety, accessibility, social isolation, especially pleasurability are important in terms of preference. And you see they are affected, the older adults are affected psychologically and physically. And they ended up this scheme, which shows the relationship with demands, COVID-19, human design, social interaction, walking distance, all the urban elements are there, and all the older adults' preferences are also there. And this is the diagram added with healthiness. You know from the previous literature, the inclusiveness, pleasurability, safety, comfort, and meaningful activities, but with COVID-19, healthiness was added to this hexagonal. And they conclude that mental health is as important as physical health, and public spaces are big potentials, have big potentials to help older adults stay mentally healthy by providing socialization, nature, etc. And they also suggested new guidelines should be proposed, which simultaneously consider healthiness and the criteria that affect older adult satisfaction of a public space. So these are all what I can present for you. Thank you for listening, and I will be very happy to answer your questions if you have. Thank you.